Right, so now we have the time for some questions. We have had 3 guest speakers. You could address questions to either of those, any of those 3 speakers, or if you have questions about what InterCommunity Health Network CCO is doing here in the community, any other questions you may have about healthcare reform, etc. So questions from the audience. I did see hands coming up here before, so.
Hi, my name's Gary Lehman. My understanding is that one of the pain clinics, Samaritan Pain Clinic in Newport, is closing and moving to Corvallis. Is that correct? And what can be done if that's the case?
I believe it is an independent pain clinic that is run by Dr. Rask, and that his site, he had a site here in Newport, and I believe that he is losing one of his physician assistants, and that led to the closure of that clinic. So it's not a Samaritan specific clinic. But the approach that you heard Dr. Cuccaro talk about is really giving us the tools in primary care to take on the chronic disease, basically, of pain management. Question?
So, my name's Dan Taylor, and I'm the defense lawyer that represents clients in Lincoln County's drug court program. And one of the big problems that we have is getting medically assisted treatment available to our clients. There's a federal requirement for drug courts to provide this service to their clients, and right now there is not a physician in Lincoln County that I'm aware of that has gone through the training necessary to provide the 3 main drugs that are used to treat opioid addiction. I'm wondering what is being done to bring one of those providers to our area.
I can tell you that Samaritan as a system is looking at its base of providers and trying to look at incentives to create more of those primary care physicians that can do MAT. And then I'm going to ask Kevin if you might comment too about MAT and some of the rules.
I can't comment too much on MAT, but I know some, and I'm not a Samaritan physician, I just want to make that clear, so this is just me as an outsider, but they're developing an inpatient drug treatment facility in Lebanon, and I know that they're going to look at extending that access to the coast. That's a big issue for them now. So all this stuff takes time, but that is an awareness. I will also say, from my standpoint, not everybody who's been on opioids is an addict, and not everybody needs to be on MAT. So that's my concern as an outside physician, is you get this overlap between pain and opioids and addiction, and really making sure that there are a select patient population that should not be on MAT, but it's not, I don't think it's as big as people make it to be. We can do more in a primary care setting, I guess, when we're looking at that process. That sort of answer your question there?
Well, yeah, and really my biggest concern is just making sure that service is available to those clients that need it. And right now we don't have that service at all.
I totally agree, and it's in the works, and they're trying to do it where it's not just the medication, but to develop the other psychosocial aspect of the program to it, which is really key. You don't want to just rely on Suboxone treatment. You want to make sure that the other access is there, and they're taking active steps to do that, so, which is exciting.
Great, thank you.
Larry?
Actually, the physician we just hired for the alcohol, drug, and rehab program is certified in that treatment and that policy. We're trying to figure out how to spread that throughout the region and the system. I don't know his start date off the top of my head. Does anybody else in the room from my group? but when he joins us, he's been running a program like that back east for a while.
Would there be a possibility that he could come over to Lincoln County on a regular basis just to manage patients here on the coast?
Well, I think we're evaluating a couple of different models, some of which would be him going to other sites and locations and working with those sites on the detoxification and the referral process, and then overseeing the actual rehabilitation process from the center that he's going to be based at. But I know when we interviewed him, we were very clear in our expectation that he would have a regional responsibility to connect with the practitioners in the local sites and local communities, but the practitioners there would still be responsible for the initial contact and referral of the patient.
Other questions from the community?
Good evening. My name is Omar. I work with the Latino community here in Lincoln County. And one of the biggest concerns that we have is mental health, especially for the Spanish speaking community. It doesn't seem like we have a lot of access, and we tried many times to direct the Latino community and get some help. Because I was dealing with 3 patients that are dealing with anxiety right now, and we haven't been able to get them the help that they need. So, what would be the resources that we can actually count with here in the county?
Want to hand it to Cheryl?
Would you like to comment just from the
Start
county?
into that?
So thank you, Omar, for raising that question. This has been an ongoing concern for not just behavioral health services, but for addiction services, for primary care services. And I know that Centro de Ayuda does assist in facilitating access to interpretation services for the assistance of our Latino population that are unable to speak English, to be able to access those services. So, you know, at Lincoln County, we do have one bilingual provider, and that individual is quite overwhelmed with the demand. And so, you know, the question really becomes, who else in the community has the ability to provide that incentive for bilingual staff to access or become part of our healthcare system for behavioral health services? And I think that's something that we really need to be looking at as a community, about how, as providers of those services, are we incentivizing individuals who are bilingual, bicultural, to be able to come work here, come be part of our service delivery system, because our Latino population is a very vibrant part of our community, and yet we don't have the staff that really can be able to assist us to the degree that's necessary. So, you know, I would offer the microphone to the Samaritan side to see, you know, how they can assist with that as well.
So one thing that I'm going to say is a lot of places now are looking at their diversity of their workforce and trying to ensure from a cultural competency perspective that you are trying to create avenues for a diverse population to enter the healthcare arena. If we know that there is already a deficit when it comes to Latino people working within mental health arenas, then we have to look at creating those educational avenues to create these linkages with the population, create the linkages with the community health workers, so that then they can be the conduits of information to the mental health services as well. The state of Oregon is actually looking at health equity and disparities quite significantly. And there's been a push over the last couple of years to address the workforce specifically in the healthcare setting to be more culturally diverse, to address that issue. Larry?
So we should probably introduce.
I should probably
Okay.
introduce myself, right?
Dr.
So you-
Larry Mullins
okay.
is the President and CEO of Samaritan Health Services, and he also serves as the Chairman of the IHN CCO Board.
So,
Has lots of insight.
in response to the comment about referring to Samaritan to take a look at this issue, we have a task force convened right now that's looking at the disparities and inclusiveness of the system overall, and it does include representation from the Hispanic community as well as several other communities. What we're trying to think through is the best way to have that outreach occur to all of the communities. So we've got a couple of folks right now that are kind of on point for this process. One of them you might know is Joanne Miller. Joanne Miller works for our community benefit activities. Julie Manning is another person that is actively involved in the outreach process. So we're giving a lot of thought to it, but I absolutely agree with you. We need to figure out a way to be more effective, both at the outreach and the communication. There's a number of other initiatives that we're looking at that will also speak to populations that are more challenged right now, and how we can provide care and services to them. So I'll leave it at that, Kelly, because if I launch off into that subject, we won't make it out of here by 7 o'clock, okay?
Sure, I can. So I'm Rebecca Austin from Lincoln County Public Health, and I'm just curious, it seemed like the whole pain movement might be moving us toward sort of a more natural approach to health, and I didn't hear a lot of comments about encouraging patients to eat healthy and to do physical activity, and I wondered if that was part of this kind of more alternate approach.
Yeah, thank you for that question. That's a great question, and I wish I had an hour because there's a lot of things I would have loved to have talked about, but I didn't have a chance to. One of the things that was really helpful in this pain pilot for me was actually kind of helping me and my colleagues refocus our practices into, or in a more holistic direction. And obviously as a nurse practitioner, that's something that I value a lot. So one of the things that I do now with my patients is I sit down with them, I listen to their complaints, I reassure them that, I empathize and I know that it's difficult. And then assuming that there aren't any red flags, we focus on exactly that. We just talk about lifestyle things. I emphasize exercise usually as the most important factor, but obviously getting good sleep. And I had slides for that too, and I pulled them out because they seemed boring. But yeah, sleep, diet, exercise, those are really kind of the mainstays of treatment, not just for pain, but for everything. So, and it kind of brings that back around. Kevin talked to us a lot about active versus passive coping, and passive coping is where we tell patients that we, providers, can fix them, and that's that cut, poke, drug image kind of sort of mindset or paradigm. And then the active coping is when we actually put the power back in the patient's sphere and say, you actually have the power to make this better. And that's something that we've been all trying to do in our practice. And I was actually afraid to have to bat the ball back into their court, and I thought there'd be a lot of pushback, but patients seem to really appreciate that for the most part, that you're giving them a say in their own health again, and that you're not taking over and just telling them what to do. So yeah, good question.
Any other questions from the audience?
Paul Virtue, my question is the telepsychiatrist program, is that just adult focus, or is there carryover into pediatric psychiatry?
Kevin's getting all his
Thank you, Kevin. Thank you for that question. And the answer is the same mechanisms that I described for me working as an adult psychiatrist are also all in place for children and adolescents in all the primary care system. So we have a team of 3 child psychiatrists in Corvallis working in the remote consultative mode, just as I am.
So the questions tonight were great and fantastic. Thank you so much for participating. Another question here.
So I also represent a lot of clients that have mental health issues. And so 2 questions. One, what can be done to provide an inpatient treatment bed for clients who are waiting to go through the civil commitment process? Because right now all of my clients are being treated over in Corvallis and then transported over here for their hearings. And it'd be much better if they could actually be here in the community that they live in and have access to their family here, access to their counsel here. And then the other question is what can be done to provide mental health services to inmates in the jail. We know that there are efforts being made to help people not go to jail as the result of mental health behavior, but what happens when that breaks down and those people end up in jail? I can say for myself, my clients right now in the Lincoln County Jail receive no mental health services at all, and I'm wondering what can be done to change that.
Can I?
Yeah, there's the commissioner over there.
I got it.
Very good question, and I don't have a real quick answer. For those of you who don't know me, Bill Hall, one of the Lincoln County Commissioners. Coincidentally, tomorrow we're rolling out Lincoln County is going to sign on to a national initiative called Stepping Up, which is really focused on the intersection of the mental health and public safety systems. And the big challenge to getting treatment in jail is finding a way to fund it, because as you well know, but maybe not everybody here knows, is once you're incarcerated, your Medicaid is suspended. At least Oregon went from being a termination state to a suspension state. But still, that doesn't provide a way to support that service for people who are incarcerated. I'm going to be looking into a couple of counties, I believe Lane County and the Hood River, the 4-county region, for their jail, Norcor. They've been able to access grant funding to get full-time counselors in their jails, and I would sure like to see that happen here. Maybe we could talk sometime about things to accelerate this at the local level.
Sounds like 9:30 tomorrow morning.
Yes, yes. If anybody's interested, love to see you at the Board of Commissioners meeting. Thanks.
And with that, you have an invitation to the Board of Commissioners meeting, and I'm going to hand it off to Kelly for our closure.
All right. I hope that you enjoyed hearing about some of the projects we're working on. Very excited about some of the opportunities that we're having here in Lincoln County and making sure that we're doing the best we can to serve those that we have the opportunity to care for here. And I wanted to thank you all for coming this evening. There are additional questions. If you want to leave those, we can collect those. And if you leave your information, we can respond to your questions. And we will be, just a reminder, we hold these once a year in each county. And so we will be out and about. And if you're interested in being on the Community Advisory Council, Ellen wants me to make a plug for anybody who's interested in being on our Community Advisory Council. There's information on the table, or you could check in with Ellen Franklin, who is the chair of our Community Advisory Council. That would be great. Okay, thank you.